You're up.
Good afternoon. Hope you are all having a lovely holiday season. My name is Marla McGinnis, and I will be your moderator for today's news conference. Before I begin, I'd like to introduce the Honorable Becky Druhan. She's the Minister of Education and Early Childhood Development, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Minister.
Thanks, Marlene. Good afternoon, everyone. I want to start by expressing my gratitude for everyone who has supported our students in learning this year. To the administrators, teachers, bus drivers, custodians, EAs, other staff, students, and families for the incredible work that you've done. The last couple of years have not been easy. As a mother with school-age children, I know this pandemic has challenged us all in ways that many had never imagined. I'm impressed by the resilience I see in students, by the leadership shown by educators, and the kindness exhibited by Nova Scotians. The strong commitment of Nova Scotians to follow public health guidelines and look out for each other have allowed us to keep our students in school. And experts agree the best place for students is in the classroom. The in-school experience is vital to a young person's development and well-being. Schools are so much more than a place to learn. Schools are where students build lifelong connections, friendships, they play, they access food and mental health resources. Throughout the pandemic, we've acted on the advice of public health and placed a priority on the safety of schools to protect in-person learning for students. I've discussed the return to school with NSTU and PSANS and have heard their needs and suggestions for continuing in-person learning. I've shared these thoughts with public health, and many of these suggestions have been incorporated in the revised back-to-school plans. We have seen the situation evolve and we're learning to live with COVID. For now, this includes following new guidelines that offer layers of protection to slow COVID spread to protect our most vulnerable. Based on the advice of public health, students will resume with in-person classes on Monday, January 10th. We'll be using the layered approach that has been so successful in our schools. Learning centers in Nova Scotia's public schools, which we know are a vital resource for many students and families, will open on Tuesday, January 4th. With the exception of Chignecto Central Regional Centre for Education, which will open their learning centers on Wednesday, January 5th. This extended break will allow for staff who will report to work January 4th through 7th to prepare for the return of students, including planning for best practices on slowing the spread of COVID. We will be re-implementing some of the past practices that have been proven to be successful, limiting movement, reducing numbers in places like cafeterias, removing excess furniture to allow for more spacing in classrooms. We continue to ask parents and staff to stay home if feeling even a little unwell and to be diligent about wearing masks properly. We also continue to ensure that ventilation systems are maintained and operating as they're supposed to. We have maintenance available on a 24-hour call-in basis. We've increased cleaning in our schools in accordance with advice from public health. The extended break will also allow for families to monitor for symptoms before returning to school and to book vaccine appointments. COVID-19 pandemic has been stressful, and I understand we are all tired. Parents, teachers, even students may have concerns about returning to school. Public health has assured us that schools remain safe. They remain a safe environment for students and for staff. In closing, I'd like to thank families, teachers, administrators, staff, and students for doing their part to keep us safe during the pandemic. We will continue to get through this, and we'll continue to lead by example to our young people by demonstrating kindness and resilience. Thank you.
Thank you, Minister, and good afternoon, everybody. I hope everyone had a safe holiday and was able to spend time with some family or friends. Today is about our plan for schools, but I first want to mention a couple of things on cases and testing. Our cases remain high, but relatively steady. I hope we're near the peak of this Omicron wave, but we're not yet seeing any real decline. Our hospitalizations have moderately increased, but so far the health system is managing despite many healthcare workers off sick or isolating. However, we are seeing a trend in increasing hospitalizations across the country, and we need to keep a close eye on that over the coming weeks. There is often a delay of 2 to 3 weeks between cases and hospitalizations. That's why restrictions continue to be important while we monitor the impacts of this variant. The variant and the way it's spreading is causing us to change the way we manage and respond to COVID-19. We are not going to stop the spread of this variant like we did in other waves. Our goal now is to slow it down to protect our most vulnerable. Given the volume of cases, that means focusing public health resources and PCR testing on those at highest risk of disease and hospitalization. Direct support from public health on case follow-up is now focused on settings where there is a risk of an outbreak among high-risk individuals. So in long-term care facilities and other seniors' residences, correctional facilities, group homes and shelters, and in other priority populations. PCR testing is also being targeted to those who have COVID-like symptoms and are at increased risk for severe disease. So people age 50 and above, or those with specific medical conditions, pregnant women, those who live or work in congregate settings, and healthcare workers and first responders. All others who have COVID-like symptoms or are close contacts will need to use rapid test kits to test at home and self-manage if they test positive on the rapid tests. And that self-management includes contacting anyone you have been in close contact with. I also want to be clear that there is not a shortage of rapid tests. If you need a test, you will be able to access one. You can access rapid test kits through all of our primary assessment centers if you meet the criteria for testing as a possible case or contact. And we are also working diligently to increase access points, especially in rural communities. But what we cannot continue to do is have wide-scale asymptomatic testing. We need to use our supply of rapid test kits differently in this wave. So please don't hoard test kits. There is no need. We have a good supply of rapid tests and we're ordering more, but the supply is not limitless. So we all need to use that supply responsibly and unselfishly. We are going to extend our approach to case management and contact tracing into schools. And these changes will allow us to live with the Omicron variant as best we can. For most of us, 2 doses of vaccine still provides good protection against severe disease. Booster doses are being rolled out and many children aged 5 to 11 will start to become eligible for their second dose. Our approach to returning to schools is about balance. One of our key priorities has always been to keep children in school whenever possible. The concerns about controlling the spread of what is generally a relatively mild disease in children need to be weighed against the clear harms and risks associated with children not being in school and learning at home. School is so important in so many ways. For some children, it's their safe place where they get the most support physically and emotionally, and many children are not able to learn effectively from online from home. I know this shift will be difficult, but it is the right path forward. There will be layers of public health measures in schools to protect students, teachers, and staff. These have proven to be effective throughout the last 2 years. And so things like reducing movement activities within a school will help minimize the spread of the Omicron variant, protect everyone, and keep students in school. A key component is masking. We also need to make sure people are wearing the right masks to ensure they have the best protection. That means a 3-layered cotton mask for children and students. The 3 layers and a proper fit are even more important now with the Omicron wave. There are some situations like healthcare settings where other types of masks are recommended and required, like a medical mask or an N95. And we're currently working now with our colleagues in occupational health and safety on the use of these types of masks by workers in non-healthcare settings. We'll have more to say about that in the coming days, but for students and the general public, a 3-layered mask is now a minimum. And just a reminder that students, teachers, and staff were given 3-layered masks, cloth masks at the start of the school year, and more will be provided. I need to come back to vaccination, and the most important thing we can all do is to continue to get vaccinated, whether it's close to 40% of the 5 to 11-year-olds who are not yet started their primary series, or people who will become eligible for their booster dose of vaccine as their age cohort becomes eligible. We also need to remember that it's key that to keep our schools and other places safe is that if people are sick and have cold or flu-like symptoms that could be COVID, they need to stay home and follow the public health measures and advice for testing and isolation. Back to you, Marla.
Thank you, Dr. Strang. We'll now take questions from reporters. We do have a record number of reporters on the line, so we'll do our best to get to as many as possible, but I do apologize if we're not able to get to everyone. We'll start with Ali Thompson with CBC. Go ahead, Ali.
Hi, thank you. There's been questions about testing for teachers, headed back into the school year. If children are going to be in school, should teachers be undergoing regular testing, or would rapid testing be made available to them should they ask for it for school staff?
Well, that is a topic of ongoing discussion. We have a finite supply of rapid test kits, and right now we as we've outlined today and just before Christmas, where we need to focus both our PCR and our rapid test kits on those who are symptomatic, but certainly as we are looking to get more test kits, and so one of the things we are looking at is depending on supply, what role could regular testing potentially play for teachers in the school environment, but that is supply dependent.
Ali, do you have a follow-up question?
Yes, I do. Thanks. I think, there's a lot of parents coming down on either side of the fence. There's many who want their children in school. There's many others who think we should take a more cautious approach. Maybe just for those parents, you can explain, I guess, how you balance all of that. And, I guess if their sentiments come into your, factor into your decision at all.
Maybe I'll start, and Minister Druhan join in. Absolutely, we're very, very well aware of the different perspectives on this, and are cognizant that no matter where we land, that there are implications for families on either side of whether you're in school or out of school. None of this is easy, and COVID has not been easy. But our fundamental point is, we've always said we need to balance restrictions with the impacts of restrictions, and that our overall goal is to protect those who are most vulnerable to severe disease and to minimize overall negative impacts. So certainly with COVID presenting now, where it's become clearer and clearer that for children and youth, it is by and large a relatively mild disease. There, on the other side of the equation, there are well learned over the last 2 years and in previous literature around the negative impacts on children and youth by not being in school learning. Those are substantive and need to play a major factor. So given where we're at, we certainly feel, my advice to the minister and to government has been balancing both those out. It's very clear to me that having kids in school is the best decision to minimize overall harms to children and youth.
Dr. Strang, you've done a beautiful job answering that, and I don't really think that I have anything to add in terms of the rationale and the considerations. What I do want to add, though, is just an acknowledgement to you, and a thanks to you and your team for providing the guidance that has kept us safe thus far, has kept our students and our staff safe in schools, and we are very appreciative of that, and are continuing to follow that guidance, and that gives us confidence in the safety of our school environments.
We'll go to Alexa McLean with Global next. Go ahead, Alexa.
Marla, Dr. Strang, I'm wondering if PCR tests will be considered a priority in school-connected case scenarios moving forward.
So right now we're saying the vast majority of kids in school would meet our criteria for rapid test kit and not PCR tests. With widespread of COVID, we're very comfortable that without extenuating circumstances that put somebody at higher risk for severe disease, that a positive rapid test kit can be reliable as an indicator of infection. So we'll continue to use that approach, and as I said, as we modify that approach based on available supply. One of the things we're looking at, along with teachers, is we've twice now sent out test kits home to families, and we're again looking at supply dependent, doing further distribution of those test kits to home. So if a child does become symptomatic, they have they have been supplied with some rapid test kits to do that immediate test.
Alexa, do you have a follow-up question?
Thank you, Marla. Yes, there have been ongoing concerns raised by parents and teachers throughout the pandemic about ventilation issues in schools. There are outstanding retrofit projects underway. They're not due, many of them, to be complete until well into 2022. Perhaps, Mr. Druhan, you can chime in. Why haven't there been interim ventilation measures put into place, like filters, things like that, to provide adequate ventilation in classrooms where they need it? And Dr. Strang, is ventilation a concern for you in schools?
So I don't mind starting, and then Dr. Strang can speak to this. So upgrades have been made to ventilation systems where that was determined to be necessary through the course of the pandemic, and some funds were used to provide those upgrades. Inspection regimes have been put in place, and all of our ventilation systems are inspected regularly, and the results of those can be seen online on the region's websites. We've also ensured that there's access to 24-hour on-call service should any ventilation systems require that. We've been working closely with public health and following their guidance around what ventilation requirements do exist in relation to COVID, and we've implemented those. And so, Dr. Strang, do you want to speak any further to that?
Yeah, I think, we have to remember this is a multi-layered approach, ventilation only being one of those, right? There's lots of, and as the minister's outlined, lots of work to go on to optimize the current ventilation systems. Putting in new ventilation systems doesn't happen overnight. But again, we've done what can be done to optimize ventilation. And I think we've seen, now Omicron is more infectious, but we've seen in the past 2 years that schools have not been a major source of transmission of the virus within the school setting. So to me, that tells me that the multi-layered approach, including optimizing ventilation, has been relatively successful. Now, Omicron means there will be more spread within schools, but the measures we have in place have demonstrated their ability to reduce the transmission and reduce risk within a school environment.
Next, we'll go to Natasha Pace with CTV News. Go ahead, Natasha.
Thank you. Dr. Strang or Minister Druhan, what do you say to parents who are concerned that there will be, 30 kids crammed in a classroom, but, rinks and other facilities are either at half capacity or events are closed altogether? How do you justify that?
Well, we've been through this before. As I said in the outline, one of our key core priorities has always been having kids in school wherever possible. And so it's not the first time we've had kids in school where we've restricted other activities. We will open up those other activities as we're able to, as we get through the Omicron wave. But it is a priority to have kids in school learning and to support a range of other of their social, emotional, and health needs. And so I'm very comfortable saying that kids can be in school, but we don't yet have add on other layers of risks into their lives by opening up other activities at this point in time.
Natasha, do you have a follow-up question?
I do, thank you. Given that you're now only giving us PCR test results, but the majority of Nova Scotians will be testing themselves using rapid test kits, are you concerned the data that the province is giving Nova Scotians doesn't represent the full picture? And does that data hold any value at all?
So we're at a point now where we don't need to detect and account for every single case of COVID. We are focusing in two areas. We're certainly doing lots of PCR testing, and that is more than adequate to give us a surveillance picture to say where are we at with the current epidemic curve in this wave. Are we going up? Are we at its peak? Are we going down? That's the important information we need to know, as well as some of the other, dynamics on age and gender breakdown about, based on who's getting PCR testing. But much more importantly now, we have to focus our surveillance much more on severity. So what is the number of cases that are going into hospital and into ICU? What are the characteristics around those cases? That's a much more important focus than trying to monitor and have information on every single COVID case.
Okay, next we'll go to Danielle Edwards with the Canadian Press. Go ahead, Danielle.
Hi, my question is for Dr. Strang. You mentioned that the province has been able to deal with the hospitalizations of COVID patients, but you also mentioned that there seems to be some employees that are off because of being either exposed to COVID or having to isolate. Do you have any sense of how many employees have been placed off work since this most recent wave of the pandemic began?
I don't have a specific number, but what I do know is that the requirements for the number of people off because they're contacts or cases is creating substantive pressures in our hospitals and long-term care facilities and in many workplaces beyond healthcare. It is a substantive issue that we need to continue to look at carefully, but it is creating pressures. There's no doubt about that.
Danielle, do you have a follow-up question?
No, that's everything. Thank you.
Okay, great. We'll go to Stephen Cook with the Chronicle Herald next. Go ahead, Stephen.
Dr. Strang, I hope I didn't miss this earlier in the session, but I'm wondering what measures are being undertaken to advance vaccination of those under 12, especially when they're all going back into school, if there are going to be vaccinations taking place in schools or special clinics, or what we can expect to see in terms of vaccination of children in the new year.
We're continuing to look at our 5 to 11-year-old numbers. There were, I think last we're around 55% of that group had their first dose, and they're starting to become eligible for their second dose. There's certainly lots of pediatric vaccine appointments through our pharmacies. So I would certainly a critically important step for any parent before their 5 to 11-year-olds come back to school is to make sure they've at least had their first dose and then having an appointment for their second dose. We have lots of capacity in the system to do that. We're also, acutely aware of the need to build as much capacity as we can and get vaccine supply so we can provide boosters as well. We're now at 50 and above, and we hope as soon as possible we'll move down into younger age cohorts as well.
Stephen, do you have a follow-up question?
No, that's great. Thank you very much.
Okay, we'll go to Paul Legere with Radio Canada next. Go ahead, Paul.
Yes, this question is just for Dr. Strang. I'm just wondering if you can elaborate the harm to children of not being in a physical school environment for their education.
Well, we certainly know that from my education colleagues that it's not the learning online and learning at home is not the optimum learning environment for the vast majority of children. Certainly being at home isolated has significant impacts on physical and mental health. We are well aware of the data on that that's emerging throughout the last 2 years. It's being around others as socializing, especially for younger age groups, is important for social emotional learning. And there are unfortunately too many children in our communities where the school is maybe their only source of good support and meeting some of their very basic needs around food and other things. The schools play are more than just a learning environment for children, and so I think it's very important we're aware of all those roles and the needs that schools meet, and the importance of having children in school wherever possible.
Thank
Do you
you.
have a follow-up question?
Nope, that's fine. Thanks.
Perfect. We'll go to Caroline Alfonso with the Globe and Mail next. Go ahead, Caroline.
Oh, I'm good. Thank you. My question was asked.
Perfect. Let's go to Shirley Fullerton with CTV National. Go ahead, Shirley. No. Okay. We'll go to Tim Bousquet with the Halifax Examiner. Go ahead, Tim.
Hi, good afternoon. Dr. Strang, you said that there's been a moderate increase in hospitalizations, but you didn't put a figure on that. I'm curious, have any children been hospitalized?
We have not to date throughout the pandemic had children hospitalized directly as a result of COVID.
Tim, do you have a follow-up question?
I do. For the minister, I'm told that large numbers of children in grade 1 and grade 2 are failing to meet their reading benchmarks because of the disruption from past, not being in school. I'm wondering if you can comment on that and address, will there be any relaxation of those benchmarks, or how are you approaching that?
Right. So the teachers and educators have done an amazing job at adapting their learning approaches and teaching approaches to address the time away from school that students have experienced. And we haven't seen kind of the significant issues that you're describing. We've seen students actually do quite well throughout the course of this, based on those targeted approaches to learning.
Okay, we'll go now to Ed Halverson with QCCR Radio. Go ahead, Ed. Ed, are you there? Okay, we'll move to Pat Healy with the Laker. Go ahead, Pat.
Hi, this question is for Dr. Strang. I have heard from some readers that they know of several people who have tested positive over the holidays and did not report that to public health. What is your message to those people?
Dr. Strang, you're on mute.
Yeah, sorry, I put myself on mute for a second. So, people who test positive on rapid tests, we're not requiring them to report to public health. What we're asking is people now, if they meet the criteria for symptoms and they're eligible for a rapid test, is to do that. And if they're positive, they can assume that positive test is reliable, even if it's a rapid test, because of the widespread of COVID. If you have symptoms and you're testing and your rapid test is positive, it's reliable. And therefore, you have to start follow all the steps. And we've got lots of information online about what people can follow to manage self-management for themselves now that they're being identified as a case. It's essentially isolating for a minimum of 10 days and then doing your contact tracing. And there's information about who contacts are and how you reach out to them and what information to provide them and what steps they need to take in terms of their isolation and use of a rapid test themselves.
Pat, do you have a follow-up question?
That's all. Thank you.
Okay, we'll go to Drake Lathers with the Port Hawkesbury Reporter. Go ahead, Drake.
Is the outbreak in Antigonish considered resolved, or are we still having positive cases related to that initial outbreak?
Well, I think what has happened, that initial outbreak has then spread broader within that Antigonish community, and then from there is spread through many parts of the province. So I think I'm not looking at the Antigonish outbreak in isolation. I'm looking at the fourth wave of Omicron, which started when a first detection with events in Antigonish, but now we're in the midst of the Omicron wave across the province.
Drake, do you have a follow-up question?
Yes, I do. And with the onus now placed on the individual, are you sort of concerned with now students coming back that they may not fully comply with the rules?
University will continue to work with universities. Universities have set up each of their own protocols in terms of bringing students back to start the school year. So they're doing it in various ways. Universities are different than our public school system. Some of them are, are relying on online. Some of them are allowing students back into residences, but still virtual learning. And we're providing robust information to their students as they come back.
Next, we'll go to Lois Ann Dort with the Guysborough Journal. Go ahead, Lois Ann.
Yes, hello, thank you. This is for Minister Druhan. What should students expect in terms of school support if they are at home with symptoms or a positive rapid test? In the past, some students have been told to get class notes from their peers.
Right. So I guess I'll start with echoing the important message that if students or families are feeling at all unwell, they should be staying home. In terms of what supports are available for absences, classrooms and schools have a variety of different supports that are available, and they're specific to those classrooms and specific to age groups. So that would be really a question for an individual at an individual classroom level. I certainly know my children, they embrace the sharing of notes. That's something they kind of go to on their own, but they also have the ability to go to their teacher for additional information. So if families have questions about what's available, they just need to reach out to their teacher to find out what can be done to support students who need to be at home.
Lois Ann, do you have a follow-up question?
Yes, I do. The second question I have is also for Minister Druhan. What options are there for families who don't want to send their children to school due to people in the home having compromising health conditions?
Right, so our focus really is, for the reasons that Dr. Strang has so beautifully explained, to have students in school and learning in school. That's the best place for students to be. With respect to keeping vulnerable people safe, I think those are questions for public health and for individual doctors to know what should be done at a home level. But in terms of what we're offering for education, in-school learning is really the best learning for our students, and that's what we're providing.
Next, we'll go to Alex Cook with Global News. Go ahead, Alex. No? Okay, we'll go to Sarah Plowman with CTV. Go ahead, Sarah.
Hi, Dr. Strang. I just want to seek a point of clarification. The website where it says what to do if people have tested positive for COVID-19 does tell people to notify public health of their positive results through an email. Are you now saying that people don't need to do that? Is this a suggestion? People could do it, but it's not necessary? If you could just clarify that.
Yeah, I mean, we're asking people to do that, but that's we know that is not going to be complete, and we're not going to be using that in any substantive way in terms of our surveillance. Our surveillance will continue to be primarily based on our PCR testing, as well as I said earlier, we're shifting to a much greater focus on hospitalization data.
Sarah, do you have a follow-up question?
Yeah, and New Year's Eve is coming up here. What advice, recommendations do you have for people? How do you think this is going to impact New Year's celebrations, and what advice do you have to keep people safe?
Well, I think it would be the same advice we gave leading up to Christmas. Keep your celebrations small, a limited number. All the restrictions are still in place. Hours of operation for restaurants, bars, they're closed at midnight. We're asking people to keep their household groups or their social groups of no more than 10, and be very careful about the number of social activities that you attend throughout the holiday. Keep it small, keep it safe, and that's no different for New Year's than it was over Christmas and Boxing Day.
Okay, we'll go to Dan Alstrand with City News. Go ahead, Dan. Okay, let's go to Jerry West with CBC. Go ahead, Jerry. Okay, we will go to Aaron McGinnis with CBC. Okay, let's try Chris Studley, Halifax Today. Okay, Mariama Parento, Radio Canada.
Yes, hi. I was just wondering if you can elaborate a little bit more on the on what's being asked to the teacher and the principals to do during that first week of January before the kids go back to school. For those few extra days, what would they have to do, for examples?
Sure. So we'll be re-implementing some of the past practices that were in place that were successful. So that would include moving around some furniture potentially to allow more spacing in classrooms, and making adjustments physically for that. There may be some scheduling changes that need to be done to support that limiting of movement. So this time will be available for them to make those changes, as well to refresh themselves on what those changes are and the measures that are in place, so they're well prepared for when students return on January 10th.
Do you have a follow-up question, Mariama?
No, that's it. Thank you so much.
Okay, let's try Bill McCush with Coastal Radio. Go ahead, Bill. No? Okay, what about Emily at the Grapevine? Go ahead, Emily. Ken Kingston, News 989 XFM. Okay, Adam Cook, Tell Isle.
Yeah, I'm right here. Marla, can you hear me?
Yep, go ahead.
Okay, I want to pose this to Minister Druhan, but Dr. Strang, if you have commentary on this, I'd be happy to hear it as well. Minister, a couple of weeks ago when you announced that there would be a province-wide early shutdown of schools on December the 17th, if I am interpreting your comments at the time correctly, it seemed that this was precipitated not so much by a rise in infections from students, but by the fact that actual staff weren't able to carry out classes in the schools the way they would normally be able to do. So has that criteria shifted in terms of what's required to call a shutdown of schools, either at the Christmas circuit breaker that we're at now or at any other time? Is it more about whether teachers or staff are available as opposed to students being infected?
Yeah, so the call was made at that point, and you're absolutely right. It was made for operational reasons because of the concern that we wouldn't have the ability, we wouldn't have the appropriate staffing. And at that time, we were things were rapidly changing in terms of the development of the new variant of COVID and the implications for in the classroom. So as we return now in January to schools, we will still be looking closely at staffing, and we'll be implementing the various tools that we have in place to support staffing and address attendances as they occur.
Adam, do you have a follow-up question?
Yes, I do. Just quickly, and again to Minister Druhan, was there ever consideration given of having a shutdown zone by zone as opposed to a province-wide shutdown that would begin on December the 17th? And is that likely to be the case as we go forward? If there's a particular rise in infections in a specific health zone, would schools be looked at for shutdown there?
So I want to make the distinction between the decision that we made in December, which was an operational decision, and it was province-wide, versus any sort of school closures that arise as a result of outbreaks or COVID. Those types of closures are really driven by public health determinations, and so I would let Dr. Strang speak to that specifically.
Yeah, I think right now what we're seeing is we have there's COVID, across the province. So we're going to take a provincial approach to this. Maybe in the weeks to come, as we get towards the end of the Omicron wave, we may look at more of a regional approach. But that would be determined. But at this point in time, we have COVID. The reality is it's throughout the whole province. So we need to take a provincial approach.
Okay, that's all the time we have today. Thank you very much to everyone for joining, and that concludes today's news conference.